Bismillah ar-Rahman ar-Rahim. My name is Nouf AlMeshari. This is my advanced education seminar presentation about behavior guidance in pediatric dentistry. I chose this topic because of the importance of the effects of behavior guidance techniques in the child dental health life among dental students, interns, and general practitioners. Dental practitioners are expected to recognize and effectively treat childhood dental diseases within the knowledge and skills acquired during their professional education. Safe and effective treatment of these diseases requires understanding and modifying child and family response to care. Behavior guidance goals: to establish communication, decrease fear and anxiety, build a trusting relationship between dentist staff and child or parent, promote child's positive attitude toward oral health care. Now we will talk about behavior guidance techniques. Before the dentist go through any decisions regarding the use of behavior guidance techniques other than communicative management, an informed consent must be signed by the patient's parent or the patient if appropriate. Basic behavior guidance is the first technique the dentist goes through with uncooperative child. Communication and communicative guidance. At the beginning of a dental appointment, asking questions and active reflective listening can help establish rapport and trust. Positive pre-visit imaginary. Patients are shown positive photographs or images of dentistry and dental treatment in the waiting area before the dental appointment. Its objectives: for visual information and to be able to ask questions before the treatment. Its indication may be used with any patient and there is no contraindication. Direct observation. Patients are shown a video or are permitted to directly observe a young cooperative patient undergoing dental treatment. Its objectives: to familiarize the patient with specific steps in a dental procedure and give an opportunity to ask questions about the procedures. It may be used with any patient and there is no contraindication. Tell, show, do. The technique involves verbal explanations of procedures in phrases appropriate to the developmental level of the patient. The tell, show, do technique is used with communication skills, verbal and nonverbal, with positive reinforcement. Its objectives: to teach the patient important aspects of the dental visit and familiarize the patient with the steps. It also shapes the patient's response to procedures and will describe expectations. May be used with any patient and without contraindication. Ask, tell, ask. This technique involves inquiring about the patient's visit and feelings toward or about any planned procedures. If the patient continues to have concerns, the dentist can address them, assess the situation, and modify the procedures or behavior guidance techniques if necessary. Its objectives: to assess anxiety, teach patients about procedures and how to be accomplished, and confirm patients comfortable with treatment before proceeding. It may be used with any patient able to dialogue. Voice control. Voice control is a deliberate alteration of voice volume or tone to influence and direct the patient's behavior. An explanation prior to its use may prevent misunderstanding. Its objectives: to gain the patient's attention and compliance, avert negative or avoidance behavior, and to establish appropriate adult-child rules. It may be used with any patient, but we cannot use it with patients who are hearing impaired. Nonverbal communication. Nonverbal communication is the reinforcement and guidance of behavior through appropriate contact, posture, facial expression, and body language. Its objectives to enhance the effectiveness of other communicative management techniques and gain or maintain the patient's attention and compliance. It may be used with any patient. Positive reinforcement and descriptive praise. In the process of establishing desirable patient behavior, it's essential to give appropriate feedback. Positive reinforcement reward desired behavior, thereby strengthening the likelihood of recurrence of those behaviors. Social reinforcement include positive voice modulation, facial expression, verbal praise, and appropriate physical demonstration by all members of the dental team. Non-social reinforcement include toys. Its objectives to reinforce desired behavior, and it may be used with any patient. Distraction. Distraction is the technique of diverting the patient's attention from what may be perceived as an unpleasant procedure. Giving the patient a short break during a stressful procedure can be effective use of distraction prior to considering more advanced behavior guidance techniques. Its objectives to decrease the perception of unpleasantness and to avert negative or avoidance behavior. It may be used with any patient. Memory restructuring. Memory restructuring is a behavioral approach in which memories associated with a negative or difficult event, like first dental visit, local anesthesia, or extraction, are restructuring into a positive memories using information suggested after the event has taken place. It could be visual reminders, like a photograph of the child smiling at the beginning of the dental visit. Positive reinforcement through verbalization could be by asking if the child had told his parent what a good job he'd done last appointment. Or a concert example to encode sensory details, including praising the child for specific positive behavior, such as opening his mouth wide when asked. The child then is asked to demonstrate this behavior, which leads to a sense of accomplishment. Its objectives to restructure difficult or negative past dental experiences and improve patient behaviors at subsequent dental visits. It may be used with patients who had a negative or difficult dental visits. Parental presence or absence. The presence or absence of a parent sometimes can be used to gain cooperation for treatment. Its objectives to gain the patient's attention and improve compliance, enhance effective communication among dentist, child, and parent, and facilitate rapid informed consent for changes in treatment or behavior guidance. Its contraindication with parents who are unwilling or unable to extend effective support. Nitrous oxide or oxygen inhalation. It's a safe and effective technique to reduce anxiety and enhance effective communication. Its onset of action is rapid. The effects easily are titrated and reversible, and recovery is rapid and complete. The safety of patient and practitioner should be considered before the use of nitrous oxide. Its objectives to reduce and eliminate anxiety, reduce movement and reaction to dental treatment, increase tolerance for longer appointments, aid in treatment of mentally or physically disabled or medically compromised patients, and for reduced gagging. Indications for fearful and anxious patient, certain patients with special healthcare needs, gag reflex interferes with dental care, profound local anesthesia cannot be obtained, and for cooperative patient undergoing long dental procedure. Its contraindication, some chronic obstructive pulmonary diseases, severe emotional disturbances or drug-related dependencies, methylene tetrahydrofluorate reductase deficiency, and recent illnesses that may compromise the airway. If the basic behavior guidance techniques couldn't be successful, the pedodontist could go through the advanced behavior guidance. Protective stabilization. Partial or complete immobilization of the child is sometimes necessary to protect the child and the oral health staff from injury while providing care. Common examples of these devices include mouth props, pedi-wraps, papoose boards, and supportive seat belts, or by gently holding the child's hands, arms, or legs. The decision to use protective stabilization should also take into consideration the child's emotional and cognitive developmental levels, the child's medical and physical condition, and parents' understanding and accepting their use. Sedation. Deep sedation can be used safely and effectively with children unable to receive oral health care in the usual manner for reasons of age, cognitive, physical, or medical conditions. General anesthesia. Its objectives: to provide safe, efficient, and effective dental care, eliminate anxiety, reduce unwanted movement and reactions to dental treatment, aid in treatment of mentally, physically, or medically compromised patient, and eliminate the patient's pain response. Finally, documentation. The patient's record must include indication and type of stabilization, informed consent, the duration of application of the stabilization, behavior evaluation or rating during stabilization, and management implication for future appointments. Behavior guidance is based on scientific principles. The proper implementation of behavior guidance requires an understanding of these principles. All decisions regarding use of behavior guidance techniques must be based upon a benefit versus risk evaluation, must take into account all cultural, legal, and philosophical requirements. Thank you.